Well, new this morning, we know the seriousness of COVID, but now up to 30% of patients are suffering with symptoms after they've already had it. Many doctors have been setting up what's called long haul clinics because of complications that can show up days, weeks, or even months after someone is sick. Now, there's a study happening right here in Arizona looking at all of this, and Dr. Elizabeth Rice is an assistant professor at Southwest College of Naturopathic Medicine, and you are heading up the multi-state study. Dr. Rice, thank you so much for being with us. And a lot of people are COVID long haulers, and they just really don't understand why this is going on. And not only is it called COVID long haulers, but also the term post-acute COVID-19 syndrome.
That's correct. Post-acute COVID-19 syndrome, long haul, long COVID. You know, you mentioned there's 30% of people who experience COVID that go on to experience this long haul syndrome. That's up to 12 million people roughly in the United States that could potentially be experiencing this very debilitating syndrome.
Yeah, and this is just awful because we've spoken with some people who are considered COVID long haulers. Tell us about the symptoms, because folks at home might say, you know what, geez, I do still feel fatigued a few weeks later.
Exactly. That's usually the main symptom, is pretty debilitating fatigue. The shortness of breath can stick around, other respiratory symptoms, cardiovascular symptoms, palpitations, and they're starting to see a myriad of other symptoms associated with this: depression and anxiety, muscle pains, trouble sleeping, digestive concerns. I mean, it really affects every system of the body.
Wow, and I know we have a list up on our screen of some of these symptoms, and I know that you guys are still doing the study, but are there things that people can do at home to maybe try to fix some of the things? I know we've heard of different, what do you call it, projects online, like the orange test.
Right. And, you know, this is really why we're doing this study, is to try to see if homeopathy can be of benefit to these patients, and a benefit greater than placebo. And if they want to join our study, you can visit us at longhaulstudy.com to see if you're eligible to participate. But that's one of the reasons we're doing this, is because there are no known conventional treatments. It's mostly supportive. And, you know, most people, what they're doing at home is just not quite enough to get them back over that hump of this long COVID syndrome. That's why we're doing this study.
Okay, so let's get more into the study, Doctor. How long is it? Where is it taking place? I know that we're so fortunate that it's happening right here in our state.
Yes, actually, we're doing it a national study. There's about 8 different states that are involved in this, but the hub is here in Arizona. And it's about 3 months. It's all televisit, which is great, so people can participate from home. A 3-month study, you have about 4 visits with a provider. That's an MD or a naturopath. And we prescribe homeopathy, which is a wonderful therapy that has been proven to be effective greater than placebo in similar diseases to long COVID, like chronic fatigue syndrome and fibromyalgia. And what's great about homeopathy is it treats the whole person. So physical symptoms, mental symptoms, emotional symptoms, all of that is factored into this individually prescribed medicine for our patients.
Sounds great. And Dr. Rice, how can people sign up?
Yes, longhaulstudy.com, and you can check your eligibility there. Please join our website, and let's see if we can help you guys.
Awesome. I do like hearing that. I'm for sure a lot of people, that help is on the way. If you're having these symptoms, if you think you are a long hauler, they are trying to fix you. Thank you again so much, Doctor.
Thank you, Monica.